Conversations for Health, dedicated to engaging discussions with industry experts, exploring evidence-based cutting-edge research and practical tips. Our mission is to empower you with knowledge, debunk myths, and provide you with clinical insights. This podcast is provided as an educational resource for healthcare practitioners only. This podcast represents the views and opinions of the host and their guests and does not represent the views or opinions of Designs for Health, Inc. This podcast does not constitute medical advice. The statements contained in this podcast have not been evaluated by the Food and Drug Administration. Any products mentioned are not intended to diagnose, treat, cure, or prevent any disease. Now, let's embark on a journey towards optimal well-being, one conversation at a time. Here's your host, Evelyn Lambrecht.
Welcome to Conversations for Health. I'm Evelyn Lambrecht, and I'm joined here today by Dr. Robert Bonakdar, pain management and headache specialist at the Scripps Center for Integrative Medicine in San Diego. Welcome, Robert.
Great to be here. Thanks for having me.
Thank you so much. And Dr. Robert Bonakdar has been Director of Pain Management at the Scripps Center for Integrative Medicine since 2002 and also serves as a member of the Scripps System-Wide Opioid Stewardship Committee. Most recently, he served as an invited presenter to the congressionally mandated Pain Management Best Practices Interagency Task Force and at the National Academies of Sciences, Engineering, and Medicine on non-pharmacological approaches to pain. He's a 2018 Mayday Pain Fellow and the editor of the Oxford University Press textbook of Integrative Pain Management. Prior to medical school, he received a Richter International Fellowship where he studied Eastern healthcare approaches in Southeast Asia, including meditation, acupuncture, Tai Chi, and herbal medicine. After completing his medical training, he completed a fellowship at the Scripps Center for Integrative Medicine, Scripps Clinic, with a focus on integrative pain management. He's certified in headache management by the United Council for Neurologic Subspecialties, board certified in integrative medicine by the American Board of Integrative Medicine, and a fellow of the American College of Nutrition. His research and over 250 presentations have focused on non-pharmacological approaches to pain management, including nutritional, mind-body, and technology-assisted approaches to health. Wow, what a resume, Robert. So how did you get so interested in pain management specifically, and where did your interest in non-conventional approaches, even prior to you going to medical school, come from?
Yeah, that's a great question. I do recall when my mom actually had a back injury at work, and she had tried a number of conventional. This was when I was growing up in Las Vegas. So not a lot of integrative options, but during her physical therapy, that was one of the few things beyond medication and things that weren't working. She got a TENS machine, and this was in the 80s. She brought this box home, and I was just fascinated by it. I was in high school, and I was fascinated with how this box that somehow provided this electrical current could provide more relief than anything else she was doing. And she eventually recovered and went back to work. And I think that's stuck in the back of my mind. So just to remind me, there's all these other approaches. And then that went on to have fascination with acupuncture, another approach that was kind of hard to understand, but seemed to have great efficacy. So those things just kind of kept me moving in that direction over time, and until I did the fellowship in Southeast Asia and got to see a lot of this in action before I started medical school.
It's definitely a different approach than most medical doctors, that's for sure.
Yes.
So you specialize in headaches and migraines. Just to set the stage, what are some of the differences between, say, a tension headache and a migraine?
Great question. So we know that tension headaches are the most prevalent headache. Everyone, at least 89% of the world's population gets a tension headache. And these are typically your typical vice-like headaches, come on with, sun exposure, dehydration, eating or drinking too much, or other, stress triggers. And they usually go away on their own, or a little bit of an anti-inflammatory. The more severe type are migraines, and those can be very debilitating. They typically come on, especially in adults, on one side. They can travel to other parts of the head. They can cause significant muscle tension, nausea, eye sensitivity, brain fog. And in the most severe cases, especially in women who get the predominant amount of migraines, by 80% or so of migraines patients are women, can go on to cause blood vessel changes to the point where it can cause stroke-like symptoms, difficulty to speak or feel your face. And that's when it's really important to get medical attention to make sure it doesn't go on to a full-blown stroke, which in rare cases it can.
Wow. And why is it that women get them so much more? Can you talk about the hormonal connection there?
Yeah, absolutely. You nailed it. I think a big part of it is the hormonal connection. A lot of the patients I see get their headaches very predominantly at the onset of puberty. They get their headaches specifically during the month, during parts of their cycle. They then go on to have fluctuations based on their cycle. On top of that, we know there's a lot of genetics to how migraines are passed down, typically in a female distribution. That being said, there are also a lot of male patients, transgender patients, others who I see who definitely get migraines, and it may not even be in their family history. It may be based on a nutrient deficiency or other triggers, maybe a gut abnormality that really brings on the migraine. And so, but we do know hormones have a big part in this.
And what I find interesting is there are so many people who suffer from migraines, yet there are several medications, obviously, for migraines. So I'm curious about what are some of the drugs that are used and their mechanisms of action, and why is it that so many people still suffer from migraines with these meds available?
And it's an important point. We know we have, up until a few years ago, we had a good toolbox of meds, although they were somewhat, general in their approach. We had the beta blockers, calcium channel blockers, your typical blood pressure medicines, which are basically stabilizing the blood vessel. And a lot of the symptoms of a migraine, which end up affecting the blood vessel, making that hose, so to speak, very erratic, tightening, dilating, causing pain, which is caused by nerve irritation. So that's where those blood pressure medications come in. But again, in a lot of folks with migraine, and again, we're talking about predominantly women in their most productive years of school and work, 22 to 55, uh, having blood pressure medications, which can make your energy bottom out, is not a great solution for a lot of folks. Then there are the anti-seizure medications, your Topamaxes and such, where can be quite effective, but again, can cause a slowing of brain function, memory issues. So that can add to the difficulty continuing those. The acute medications everyone's familiar with are the triptans, things like Imitrex, where we know those can stabilize using serotonin receptors, the blood vessels, and the inflammation of a migraine, but those can have pretty significant side effects for some women, and men, as far as feeling tingliness, just feeling off. So they all can have a downside. Most recently, we have the CGRP family of medications, which block uh, a substance which, interesting enough, is actually created in the gut or exists in the gut and the brain, and is affected by stress and sleep, and modulated by some herbals that we'll talk about, I hope, like ginger. Those block it significantly. Problem with that is if you block it too significantly, it can cause GI issues in some patients, like severe constipation, which can make those difficult to continue. And there's a few other medications that are used as well. But over time, we know women, especially who are busy, don't always get the right diagnosis. They may not get the right attention at work to be able to treat their headaches, go in for acupuncture, go in for different treatments, and or they may stop the medication without telling their provider just because it didn't work. They don't want to do another medication that may have side effects. So we have a group of patients that really is needing additional treatments. And to add to all this, we know migraine is significantly linked to lifestyle stress, lack of activity, diet. So all those things that really we don't have a magic bullet. So you need to really look at integrative medicine if you're really going to reverse the trajectory of migraine. So that's kind of all the reasons that come to mind.
Thank you. I have a few follow-up questions. The first one is, what was the compound that you were talking about in the gut and the brain that ginger affects?
Yeah, calcitonin, it's calcitonin gene coupling protein, CGRP, that is an important molecule that we do know is really important in accentuating headaches. And we know that can also go up when there is GI dysfunction, stress, poor sleep. So it's a molecule that in many ways follows along aspects of the migraine trajectory. These medications block it or modulate that molecule's ability to cause severe migraine. So, which is why they're quite effective, these CGRP modulators. And patients do get a lot of benefit. That being said, you still need to go back and look at what are the areas of lifestyle that you can hopefully optimize to, fully control the migraine and minimize the need for acute medications.
Definitely. The other question I had, and maybe this is just me going on a limb because we had several cardiovascular episodes and we talked a lot about nitric oxide production and blood vessels and natural approaches to not just hypertension, but just optimizing nitric oxide and vessel health. And so I'm curious, some of the natural approaches that we use for treating blood pressure, for optimizing nitric oxide, do those work for migraines as well? I haven't looked into it. I'm just thinking out loud.
There are some folks who are very sensitive to those molecules, and so you might hear about those folks who, let's say, exercise and it can induce a migraine. So I think at the same time that we do know that some of those molecules can relax blood vessels, if the brain is already quite sensitized and primed for a migraine, doing exercise or doing other things that increase the levels of nitric oxide very quickly can sometimes be a trigger. Over time, though, if let's say we do titrated exercise, so steadily increasing it, or these supplements are utilized, or dietary approaches that have more nitric oxide are utilized, those can be very helpful. And I think in the end of the day, we want to increase the amount of uh, oxygen to the brain, nitric oxide in the system. Just we don't want to do it too quickly, too fast.
Gotcha. That's helpful. And then the other question I have is going back to the hormone piece. Is it more of a connection to estrogen or is it more progesterone?
It's usually kind of a shift. We know, for example, when women become pregnant, their headaches can, with the increased estrogen, that can actually improve headaches quite a bit. We also know it can be related. So the cycling headaches during the menstrual cycle can sometimes be a shift in the progesterone estrogen ratios. In some cases, birth control pills are utilized to help stabilize that, and that can be helpful. That also has some downsides and can prompt headaches in certain folks. So you just have to be careful and work with the hormone expert that can really navigate that. But it can be a helpful solution beyond everything else that we'll talk about.
And you also mentioned some of the genetic link. What are some of the genetic SNPs that are involved in migraines?
Yeah, so I mean, everyone's heard of the MTHFR. We know that can increase not only the propensity for headaches with especially double heterozygous or homozygous status. We do know that in general that can also increase the intensity of the pain. So in general, if those areas are noted, we do some testing for that. We try to be aware of the fact that this person may be more prone to getting more intense headaches, more frequent headaches, until we hopefully can modulate that with the right dietary approaches or supplement approaches. And we do a lot of nutrient testing, Vibrant America and others, to make sure not only just the B vitamins, but anything that's really affected by methylation is taken care of. COMT, SNPs, related SNPs can also affect pain in general, and that can also add to the intensity of migraines. Those are probably the two most common, although there's a number that have been described as well.
Robert, can you speak to the role of central sensitization in pain? I know a bit about it just in general pain, like joint pain and, IBS type pain, but I don't really know a lot about it when it comes to migraines.
Absolutely. So we've known about the phenomenon of central sensitization in especially neuropathic conditions like CRPS or phantom limb after amputation, where there's just a hypersensitivity. More recently, that term has been introduced. Actually, it's pretty recent, 2017, where the term nosoplastic pain, which is kind of the newer term for central sensitization, has been introduced, which basically describes pain that's really existing in the brain, meaning like in fibromyalgia or IBS, where even though there might be a physical focus, tight muscles in the upper back and neck, pain in the gut, the the provocation, the hypersensitivity actually exists in parts of the brain that the volume centers of that pain have been turned up. So the real solution really is about things that can turn down that volume button. In migraine, it's reducing nutrient deficiency and fibromyalgia. Similarly, maybe doing graded exercise to improve oxygenation to the tissue, which then can send signals to the brain to reverse that. The biggest part of this that I educate patients about is it's really important to know that these coexist. So they didn't do anything wrong when they had migraines, and then a few years later they developed fibro, and then a few years later interstitial cystitis or IBS, etc. It's part of the course of what we call chronic overlapping pain condition, or another term, COPC. About 50 to 60% of patients in any of these one conditions can go on to develop another one. So, and that's about 5 to 10 times higher than for patients that don't have any of these conditions. So the brain sort of gloms onto other parts of the brain to create these pain conditions. The good news, because this obviously all sounds very scary to patients, is that when you treat one of these conditions effectively, like whether migraine or fibro, it can be significantly helpful for another. I'll just give you one quick example. In Spain, they did a study of CoQ10 at 300 milligrams. It was a high dose in patients with fibro and migraine. And they found that at that dose, at I think 8 weeks of treatment versus placebo, significantly improved not only CoQ10 levels, as you'd expect, it increased ATP levels in the muscle, proven by biopsy, and it reduced pain in both fibro and migraine by over 50%. So
Wow.
that's the good news. You do a good job in one, it typically helps the other.
Great. So you talked about nutrient deficiencies a couple of times. So let's get into some of those and treatments. So what are some of the most common micronutrient deficiencies that you see in your migraine patients?
Sure. I think the ones that the listeners are most familiar with are, we've heard about magnesium being really important and being typically low. It does get depleted with each migraine. And the more migraines you have, the more depletion you can expect. B2 or riboflavin is also mentioned in that. What's interesting about B2 is actually not that common to be deficient in it, but we do know having super therapeutic levels of it can be helpful. So I do testing for, all the nutrients as much as I can at my clinic here at Scripps. The ones that I see, magnesium tends to be low when we do the RBC magnesium, or it tends to be low normal. So I tend to treat low normal, even if it's not deficient, because I know having that magnesium tank filled will help mitigate the severity of the migraine. B2, as we talked about, riboflavin. We also know that vitamin D is really important. The fact that has recently been developed is that if we have a deficiency of vitamin D, for every 5 points we can go up, it can reduce migraine likelihood by 22%. So that's pretty big catch if you can treat it.
Yeah.
And that usually has to do not just with vitamin D, but we know you treat vitamin D, what does that do? It enables you to have a better GI net for the magnesium, which then helps that deficiency. So those three are really important. Omega-3s are also quite important. I would say probably 2/3 or more of the patients I do an omega check or omega quant are deficient in omega-3s, or they're very high in the omega-6 to 3 ratio. That we know can significantly prolong headaches or increase the likelihood of a migraine. So we work with omega balancing. We do know also the B vitamins, other B vitamins, B12 and folate, especially B12, can also be deficient, especially in folks that are having migraines later in life. Other deficiencies that have been described is alpha lipoic acid and CoQ10. CoQ10 actually tends to run low starting in the teen years. So some patients I've had, in their 30s with migraine probably have been dealing with a low level CoQ10 deficiency or insufficiency for probably decades, which is kind of explains also the fatigue component.
Interesting. I have quite a few follow-up questions on some of these nutrients. With vitamin D, what level are you looking to get somebody to?
Yeah, so we know that the deficiency ends at 30 officially, but really I'm trying to get them to about 40 to 50. One study showed that a level of about 50 was optimal for preventing migraines. I'm not one to typically try to get it into, like 80 to triple digits, because there's really no proof that it does any better than getting them into the 40 to 50s. And there might be some risk in some populations. So I just try to get them out of the basement, get them into that middle ground, and that I know that's going to do other things like improve their magnesium level, and it can also help reduce nerve sensitivity. We know it can help reduce chances of depression. So that's one I key on as much as possible to test early and treat as quickly as we can if it's low.
Great. And then with magnesium, are you using magnesium glycinate, citrate, L-threonate? Are you using a specific type? And also, are you supplementing pretty high doses?
Yeah, so we try to look at, what's their intake. We know the RDA or daily intake is around 400-ish. And many patients, we know, are not getting even 200. So we start trying to get it with diet and giving them suggestions because that's the least likely to cause GI issues. But we do know with regular migraines, you probably need double that just to keep up with the deficiency. And when I do start, I try to do, off out of the gate, a chelated form like magnesium glycinate or biglycinate to use at bedtime because we know that can also help with muscle relaxation. There's other chelates like magnesium taurate, malate; those can be good too. Someone has severe constipation, it's not a bad idea to try citrate, oxide, sulfate. You might have a double benefit, but over time, that can be irritating with bloating. So I try not to use those long term, although we do know they're more cost effective. So some magnesium is better, but obviously you want it to be tolerable for long term use. And dosing is probably 250, go up to 400, and then also increase the dietary amount. So most patients are 400 to 500 supplements, but that's all based on tolerability. Some can't do more than 100, even of the chelated form. So we try to push more dietary intake.
Gotcha. And then with riboflavin, you also mentioned that you supplement there. What are some of the doses that you use with riboflavin?
So riboflavin is one that I actually disagree with the recommendations in the guidelines, which say 400 milligrams. And the reason for that is it's an evidence-based guideline, and there's obviously pros and cons. Most of the studies have used 400 milligrams, and that was just the chosen dose. The problem with that is we know that the body cannot absorb more than 27 to 30 milligrams at a time. So there is probably a theory to superdosing it, super therapeutic, but at a certain point, you can get that probably from 50, 100, 150. Going to 200, 300, 400 is more likely just to cause more GI upset. It's not major. So if someone's on 400, it's working for them, keep going. Your urinary output will be extremely yellow, neon yellow. I try to go like 100, 150 is fine. And if I can split it, we know that you absorb better if you can split it, many nutrients that are typically having difficulty absorbing, amount at one time.
Okay. And then with omega-3s, generally when you're looking at an omega-3 index, what's the average score that you see in your patients?
Oh my goodness. I just saw a 2 the other day.
Oof.
And you're trying to get it close to 8.
Yeah.
If I see a 4, I'm happy going towards a 5. What I also look at is the omega-6 to 3 ratio, and I see 30 to 1, some very high numbers. So I know we have a lot of work to do. In that case, we talk about trying to be on a good omega dietary source, and that works for some people, not everyone. We obviously good sourced seafood, seeds with high omegas, chia, and other types of sources if we can. We also need to figure out, are they getting a lot of poor omega intake from packaged foods that use a lot of not so good oils, and that's the real key, because we know it's probably as important to lower bad omega-6s as it is to increase omega-3s. And then at the end of the day, I have them also take about a gram and a half of a highly potent EPA, DHA, maybe DPA, which is you're hearing more about that. We know those are all the ones that are really healthy for lining our neural highways. So we know that that's really important to get at least a supplement amount until headaches quiet down, and then hopefully you can continue with diet.
Great. And you've mentioned diet a couple times. I know that at Scripps, at the Center for Integrative Medicine, you do use dietitians as part of the program. So what are some of the diets that have been shown to be beneficial to treating migraines?
Yeah, it's an important question because patients come in interested in all kinds of diets, or they've heard, this diet or that diet. I think as long as we can meet with them, I meet with them initially. I have a wonderful dietitian, registered dietitian here, Kathy Garvey, who's been working with me for over 20 years, or almost 20 years. And we just try to get it towards as best we can, an anti-inflammatory diet that's something they can follow. So that could be a DASH diet. It can be a Mediterranean diet where we increase fruits and vegetables, bring in good oils, and if they're on grains, make sure they're getting as much whole grains as opposed to refined grains. Getting a lot of omega-3s in their diet as best we can. The healthy eating plate is another one. There's some low glycemic diets that have been proven. So any pretty much anti-inflammatory diet approach that works for them works for us. There are some folks that need specialized diets. So some folks are trying to also tackle their diabetes or prediabetes. So we might use a ketogenic diet, although, you need to be careful with the amount of, we know ketone bodies can be helpful for calming the brain, but we also know that long periods of fasting can also provoke a migraine. So we need to find the right candidate. Another diet that we've used in specialty circumstances is the low FODMAP diet in patients with IBS plus migraine. And we just published on that, showing that it can help both. And it really, if there's one condition that sits in front of you as a prime example of the gut-brain axis dysfunction, it's migraine, because typically those two go hand in hand and they kind of create a vicious cycle.
So do you find that, I know that you've looked at the gut because we've talked about that many times, you and I. Do you find that it's 50% of your patients with migraines have something that will show up on a stool test that's going on in their gut? Do you think it's higher or lower?
Yeah, I think it's probably depending on what test we do. If there's a lot of IBS, bloating, we try to rule out SIBO because that can be undiagnosed. And until you clear that effectively with medications and natural therapies, it can be hard for the gut to really help the brain. So that's a methane breath test. We also do microbiome testing, looking at, are there really inflammatory species? Is there low diversity? Are there, a minimal amount of short chain fatty acids, which we know help migraines? And if they're deficient, then we need to really find dietary approaches and lifestyle approaches to do that. But I would say more than half will have some type of gut dysfunction, depending on the test you do. H. pylori is also more likely in this population. So checking that in your microbiome sample is important. If you treat that, that can be really important. Celiac disease has an incredible cure rate. If it's an undiagnosed celiac disease, like 75%. If you find celiac, go on a low gluten-free diet, that can be significantly impactful for migraines.
Very interesting. So we know that food sensitivities and allergies, well, you just mentioned gluten, that they contribute to migraines. What are some of the other sensitivities and allergies that you commonly see in patients with migraines?
Yeah, I think these are ones that our patients often recognize before they even see me, and they might have dairy in addition to gluten. Some folks have specific sensitivities to highly processed foods, aged meats and cheeses, anything that might have, sulfites, nitrites. They also have issues in some cases with foods that might have high histamine content. And that's just not the food. It can also be food that's left out or left over that's been sitting. It can create more histamine. There are folks that have issues with citrus. So at the end of the day, if it gets to the point where we can easily identify in history, and that's not always that easy, great. We can kind of pin it down. Kathy our nutritionist, and I can kind of work around it to create a complete, nutritious approach to getting all the nutrients. If that's kind of more of a guesswork, then we sometimes do some blood testing. We do RAST allergy testing. We do some IgG testing, although there's pros and cons in some cases as far as how valid they are. If there's severe environmental allergies, we have them see our allergy colleagues. In fact, the person we talked about with the low FODMAP diet, she also had allergy issues, so she got a full panel through our allergist to look at how likely are allergies, and she did have some issues with some of the FODMAP foods, which even though we were going to restrict them, and she had already, they were still causing some increased immune response. So I try to do allergy testing, especially with the higher intensity of allergy symptoms, to make sure, like, hey, we're going to eliminate all these foods. We've got to make sure that we're not doing it. We're doing it for a purpose, and we're not going to do it long term. So the other piece of it is reintroduction. After your symptoms are better in a month or two, we want to slowly get that back into the mix to hopefully not restrict any healthy foods that may not be needed to be restricted. And most patients are surprised that they can reintroduce it, because once they say, oh, I reacted to avocados or bananas or whatever, I can never have that again. That's really not true.
And switching to another one, do you see that overconsumption of caffeine also triggers migraines?
Yeah, absolutely. I'm happy to answer that one. I just wanted to add one thing about enzymes,
Yeah.
because I know that one of the products that I like really is diamine oxidase, talking about histaminic foods, which can come from many different sources. There's also FODMAP related enzymes out there, and other digestive enzymes. So at the end of the day, patients have a lot of options. I mean, elimination is great, but you're going to go out, you're going to eat. These enzymes can be helpful in mitigating that. And we do know genetically, diamine oxidase, about 3/4 of migraine patients cannot create enough diamine oxidase, so they're more prone to histaminic food. But luckily, we have those supplements to help with that.
Helpful tip. Thank you.
Yeah, no, absolutely. I think patients really like having that option, especially when they're eating out. With caffeine, we also know, going back to genetics, some folks are slow processors, so 1 cup in their body feels like their nervous system is having 4 or 5 cups. So again, patients identify that if they're having real triggers, meaning they got to wake up early on Saturday because if they don't get that cup of caffeine, bad migraines coming, then we really need to change the relationship to the caffeine or the coffee, and wean it as best we can. In most folks, though, if there's not a significant issue, I'm not adamant. Maybe because I'm a coffee lover, I like coffee, tea, etc. I think if we can keep it to under 3 cups, if we're not going in excess and doing severe amounts of caffeine, then your body will probably balance that out. Some patients, we do need to try to taper it or come up with ways to alternate the amount of caffeine. And rarely we might do genetic testing to figure out if that's needed, but we can usually mitigate it using dietary approaches if it's needed, but it's not that common.
Okay. And going back to a ketogenic diet, do you find that it's helpful in specific patients? Do you ever also do it along with, fasting or time restricted eating? And are there patient types, who benefit more?
Yeah, no, I think when we talk about ketogenic diet, we really have to bring up the concept of glycemic control. And in many cases, we know that patients' blood sugars not only are going in the pre-diabetic arena, and that's causing undue harm all over the body, but they're also getting hypoglycemic at times when they can't predict. So having stable protein sources is important. Number one, I say meal consistency is important. Hydration is super important. Both those in and of themselves are probably the areas we start with. Make sure you're hydrated enough, and if you're like missing random meals all over the place, that's going to provoke headaches. Or migraines. That being said, working with our dietitian, we might say, okay, we want to control your blood sugar, help your hemoglobin A1C, help your lipids and your migraines. We might try a ketogenic type diet as far as what you're eating to go more towards the healthy fats. Again, trying to get good omega-3s, low omega-6s. And then in some folks, again, this is very individuals, we can do, I've had patients try intermittent fasting. It doesn't provoke their migraine. Some folks, if they try to do an 8 or 12-hour fast, they get much worse migraines, and we don't really push it. The key point with ketogenic diet is it has to be tempered so that, the research shows in the first month of a ketogenic diet in the right population works tremendously well to reduce migraines. Month 2, 3, and 4, it can be hard to, either it's because it's hard to keep that diet going or something in the body kind of outsmarts the diet. Migraines can recur. So we have to do it, I think, in a moderate fashion, both to help other medical issues if we can, and just improve overall the health of the diet, which can go into ketogenic arena and not be high glycemic. And that's key. Why are we doing this? Both improve migraine and typically metabolic, dysfunction.
Yeah, for sure. I want to talk about a few more supplements that you use in your practice. So we covered some of the vitamins and minerals. What are some of the other compounds that you use to treat migraines?
Great. Yeah. It's a long playbook and it's very individualized, but if there's sleep issues, I like melatonin, and GABA, because we know that deficiency in melatonin also occurs, especially in migraine, especially as we age. If there's sleep issues, I like to use that. With stress issues, L-theanine and GABA are important. Other things I mentioned briefly, but alpha lipoic acid can be really great especially if there's glycemic issues, neuropathy issues, lipid abnormalities. That's really important. We talked about omegas, but in some cases, we also need to talk about resolvins, which are another upstream aspect of omegas that can be really helpful for pain and inflammation and migraines. Um, Antioxidants, hopefully you're getting that through your diet, but vitamin C, vitamin E, especially for menstrual migraines, can be really important. So I like to keep that at the top of my head, my discussion with the right patient population. Um, as far as minerals, zinc has also been shown, and iron, when deficient, to increase migraines. So we want to make sure we're getting enough zinc. With iron, we know that can also cause not only migraine, but mood issues, anxiety, depression on top of the migraine. We're not exactly sure why, but I check iron, and that can be sometimes overlooked. But while we're looking at all the vitamins, but those minerals are really important. I really like some of the zinc chelates that are out there that can help also with gut function. So I look at zinc, which also gets kind of forgotten.
And then what about some of the anti-inflammatories, like some of the herbs?
Yeah, absolutely. Definitely didn't want to forget the herbs. So ginger is a great one. It's top of my list for migraines because we know it helps with nausea. We know that it also helps with aspects of serotonin modulation, kind of like some of our triptans do. Some early studies have shown similar benefit acutely, and that's an important point because most everything we've talked about is for prevention, but ginger can actually
Yeah.
help acutely with migraines. One study compared it to triptans, and it worked well comparatively. Another study added it to an anti-inflammatory cocktail like you might receive in the ER, and showed that patients that got ginger versus placebo had a faster rate of pain relief and less generalized adverse effects. So it can kind of mitigate a lot of the aspects of headache and migraine. Curcumin, I like as an anti-inflammatory. We also know that if you get the right kind of curcumin, it can have some brain relieving effects as far as reducing brain fog, which can be really bothersome for a lot of the patients I see. Boswellia is great for sort of the constant headache, cluster type headaches. That has some preliminary evidence. Grapeseed extract. So, grapeseed extract, along with ginger and butterbur, have all been shown to lower CGRP levels in some preliminary studies. So I like grapeseed, I like ginger. Butterbur, I really minimize its use just because we know if you're not getting the right, really good brand, it can sometimes cause some liver issues. So I save that and use it very sparingly. So those are some of the herbals that I really like. Ginkgo is also a good one because we know it modulates blood vessels and it's anti-inflammatory. Rosemary is a good one because it also is anti-inflammatory, helps brain function. And some of the herbs I actually like in topical form. So things like peppermint, another menthol family, I use in topicals that can be really helpful for some of the tension that patients have.
Interesting. Thank you. Lots of gems in there. We could probably talk about all of those
Throw in
at
as much as I
length.
can. Right.
Yeah. Thank you. With butterbur, I feel like if you get a quality butterbur, they are usually PA free. So I guess I'm not personally as worried about that one, but if you're just randomly purchasing it, it could
Yes.
be a
Yeah,
problem.
if you're working with a trusted provider, that's a whole different scenario. But yeah, absolutely.
Yeah. And then with the grape seed or even with rosemary, with curcumin, what are some of the amounts that you're looking for?
So it's like grapeseed, usually 100, 200 milligrams are typical doses of, high oligopoly, component grapeseed extracts. And they're all kind of different. There's a few different good types out there. Just look for a standardized one. For curcumin, 400 to 500 milligrams minimum, going up to 1,000 if you can on a daily basis is a good idea for sure.
So that could be dependent on how well it's absorbed, right? Because we know that different formulations have different
Yeah, that's a whole
bioavailability.
different episode. I'm sure of all the different types. But there's several that have been well tested. Look for standardized brands for sure.
Yeah. And then I had another question since you mentioned ginkgo. I did an episode recently with an ophthalmologist on everything eye health. And so we talked a lot about the nutrients for eye health, and those can be very helpful in migraines too, right?
Yes. So eye symptoms are kind of one of the worst aspects of migraines. So some patients know a migraine is coming on because they get, an aura, scintillations, zigzags, or they get extremely sensitive to light. So migraine is coming on after the migraine or during the migraine. They can also be extremely sensitive. And so ginkgo in some cases can be helpful for that. We also know kind of the lutein family, xanthine family can also be our natural blue blocker to help us mitigate how environmental lights and sun affects us. So there's been studies in patients with migraine who have significant photosensitivity that those eye supplements, retinal pigment enhancers, can be quite helpful in reducing, especially the photosensitivity, and in some cases, probably help the migraine by supporting the antioxidant component of what we talked about with migraine folks being low in antioxidants.
And it's something else interesting that you said were that most of these things are for prevention. So with the migraine drugs, I think a lot of those are for like acute, maybe as well as prevention. I could be wrong. I don't know as much about them, but do you find that there are certain things that actually help acutely? I know for headaches, to me, I'm like CoQ10, peppermint oil on the temples, and it's
Yeah.
like poof, but I don't think a migraine is quite as simple to fix.
Yeah, no, that's a really good. So we try to maximize our patients' acute toolbox as much as we can. Their prevention. So in my scenario, they're typically working with a neurologist who has them on good, recent medications, or CGRP modulators, et cetera. They might be on an anti-inflammatory to be used occasionally. So what I come in with is some acute herbal supplements, typically your gingers, curcumins, boswellias, grapeseed, and they come in different forms, and folks can find those in combinations that work for them. We also use topicals that can either be over the counter, like a peppermint oil, or a compounded gel that can have things like peppermint, magnesium, as well as some prescriptions like ketoprofen, cousin of ibuprofen, that they put on muscles and areas that are really having difficult time. We sometimes use lidocaine that's available over the counter to kind of break the nerve cycle. I use a lot of devices at home. So these are things that patients might utilize. These are FDA approved devices that go in various aspects of the forehead or the back of the head that can be really helpful in reducing the severity of migraines. And, when it comes down to it, I think one of the most powerful things that we often forget about is education. So migraines can be incredibly scary, especially if they're new to you. You think you're having a stroke. You think, what's happening in my brain? And sometimes it's hard to figure out. And your whole body can suddenly feel like every aspect of it, GI, nerves are all going awry. So I think educating patients on what is a migraine, what is happening, what's the cycle of a migraine, for the most part, trying to make people less fearful about it is really important. And then making them aware of all the positives and negatives of various treatments, conventional and complementary integrative, can really be really helpful. And in fact, studies show that if you improve a patient's knowledge and confidence in migraine with education, that in of itself can be almost as helpful as a separate medication. We know if you
Wow.
add that to a medication, it can kind of double the benefit of the medication. So it's kind of the secret sauce. So we actually did a recent study on using an educational website with a artificial intelligence sort of chat that can answer questions in real time. If patients, let's say, have GI dysfunction, they want to ask about, I need a recipe to increase my magnesium, but it can't have gluten and it can't have this. It can help with that. Things you might not want to ask in the clinic. And we did a study that hopefully we're presenting at a headache meeting upcoming that showed using that education can improve patients' confidence and knowledge base. So it's really about the teamwork of making sure patients aren't feeling passive in the process of treating their migraine. They know about all their options and they know when to use them. That in of itself, I think, can be really helpful when those migraine symptoms come on.
Where can practitioners find that tool?
Okay.
Yes.
Yeah, I was going to mention. So the website is called migrawell.com, and that's MIGRAWELL. So beginning of migraine and well.com. And then on that, they will see Maya, which is our migraine AI assistant. And it's free to try out, and hopefully it provides some benefit. So
that's awesome. Thank you so much. Robert, I do have some really quick rapid fire questions that we ask everybody. What are your top 3 favorite supplements?
I mean, personally, based on some of the health issues, I think number one, it has a lot, it's very individual, but for me, I think, ginger has been very helpful for me for a lot of the GI issues that I've had. I really like L-theanine, which is a good one, especially for some of the stress that hits me in medicine. And curcumin, because we didn't talk about it, but it's great for glycemic control, which is something I'm trying to stay ahead of in my health trajectory. So I'll stop with those 3.
Okay. And what are your top 3 practices that keep you balanced in your busy life?
Yeah, I would have to say Tai Chi is probably my most important thing that I try to do every day. Not 100%, but since I began learning that in the early 90s, I've tried to stay with that. I try to do courses for docs and healthcare providers to teach them that it's something that, a few minutes every morning can really balance your nervous system. And I try to do that. I try to do what I preach. So I do that. I also think a gratitude journal, as cliche as it might sound, is incredible to make you look at some of the important parts of day-to-day living.
And final question for you is, what is something that you've changed your mind about through all of your years in practice?
In medical school, even though I was integrative minded, the concept of dysbiosis and leaky gut was never one that really was well respected. And I've really come to think that it's at the core of so much of what we do or miss. In many cases, when we see that patient with migraine and IBS, and we don't fix the gut, and we just say, okay, we're going to fix your migraine or try to approach your migraine. If you don't really respect the gut, and I've grown to say we need to really focus on that before we do anything else. And I think that's something that I think all practitioners are slowly getting to. Some practitioners from day one, the naturopathic community, had it right. Many other nutritionists had it right. And I think we're learning that in conventional medicine to really respect the gut and the gut-brain axis to really be able to optimize health.
Yeah, thank you for that. And thank you for spreading the word to other MDs. So thank you, Robert, so much for this conversation, for all of the gems that you share today and everything that you do in the community. I appreciate having you on the podcast. Thank you.
Absolutely. My pleasure. Thank you for having me and look forward to being back. Good luck with everything.
Thank you for tuning in to Conversations for Health. Check out the show notes for any resources from today's show. Please share this podcast with your colleagues. Follow, rate, or leave a review wherever you listen or watch. And thank you for designing a well world with us.
This is Conversations for Health with Evelyn Lambrecht, dedicated to engaging discussions with industry experts, exploring evidence-based, cutting-edge research, and practical tips.